Hello. This presentation is on the Methodist College Nursing Philosophy and Theoretical Framework. Our nursing program philosophy states that we prepare baccalaureate graduates to practice as professional nurse generalists. They practice independently and collaboratively with other health professionals, and this is to promote health, prevent disease in our patients, and to attain, maintain, or restore wellness wherever our patient is at. Within this framework, there are components that are important to understanding the philosophy, and one of them is the person. This is the person is a unique composite of commonly known factors or innate characteristics, which are things like their physiological characteristics, their psychological, developmental levels, their social economic status, and their spiritual needs. All people possess self-determination and free will, which means that they get to choose to follow our care plan and need to be a part of the plan from the beginning. The person is also a system that consists of all these dynamic composites of interrelationships of those variables that I just said that influence and are influenced by the environment that they live in and the constant interaction with their internal environment, the internal part of their bodies, and the external environment. What is the environment? The environment consists of all the internal and external conditions, so all the processes within their body and all the elements within their environment, their family, their friends, where they work, where they live, their neighborhoods, things like that. So circumstances, influences surrounding and affecting the person. The relationship between the person and the environment is constant and reciprocal. What does this mean? This means that we are systems. We are systems that are interrelated and have interdependent parts. We are more than the sum of all of our parts, and what change happens in one part affects all the other parts in the whole system. So changes within our body affect each other. Changes in our environment affect things that are happening within our body. This schematic kind of shows, if you think of yourself as you are as the student, and think of the things that affect you, your peers, the courses, technology, advisors, teachers and mentors, and the administrative structures, and then eventually your clinical experiences. If you look a little bit farther out, everything about the university or college and its structure also affect you as the student. We look at different kind of resources, research and education, and then if we move out farther, there's a lot of other influences on us. Economic, state agencies that affect how we get our grants and our state aid, um, the Higher Learning Commission, how we are accredited, and so how our program is put together from the beginning. Also, a part of our philosophy has to do with the health. That is how we view health, and it's usually on a continuum. It's a dynamic state of being, as well as a process that exists on this continuum from wellness to death. Um, there's a state of optimal wellness, where all our needs are met, to reduce wellness states with unmet needs. This dynamic state and process of health spans from birth through death. If you look at the illness-wellness continuum, you can see that we cross back and forth over this wellness paradigm many times during our lifetime, from complete disability and maybe premature death, so the treatment paradigm, all the way up to the wellness level, the highest level, with awareness, education, and growth in how we care for ourselves. The nursing interacts in the philosophy and with the people with the system. So nursing is a learned profession whose members are capable of responding to a variety of healthcare needs for the client system, which can be individuals, families, or communities. Nurses advocate and lead and care for all of their patients. They make decisions, so they're decision makers. They're client counselors, they're research consumers, they're change agents and leaders and co-coordinators. Many of these roles we're also going to discuss later again in the program or in the course. So what is a nurse or the nursing process? The nursing process has to do with assessing and gathering data, analyzing it, so IDing problems and formulating nursing diagnoses, not medical diagnoses, but nursing diagnoses. Planning, so writing the care plan to meet the goals with the patients, a part of the plan, and then implementing them, so carrying out the nursing interventions that you've put in your plan. And then at the end, evaluating it, so collecting data again, so it moves back to assessment, to determine the extent to which goals were achieved, and then revise our plan as needed. So what is the nursing student that's a part of this process? The nursing student are successful students that are internally motivated and self-directed learners. That's what the philosophy is built on. We care about the student's holistic growth and development, and it's supported by our curriculum, so the classes that you're taking, and extracurricular activities that you can participate in while you're at the college. The student is also motivated to integrate their professional values, attitudes, and expectations of the professional nurse. This brings us to teaching and learning. So within the teaching and learning environment, faculty and students participate in educational partnerships. It isn't us making you learn, it's us learning together and developing the ways in which you need to learn the content and practice the profession of nursing. The environment supports achievement of professional and program goals. Faculty also provide many different learning opportunities that are appropriate to the student, so where you're at in the program and the course that you're in, as well as program objectives. What are health systems? This is where we practice. We practice within the healthcare system, and it's comprised primarily of subsystems of consumers, healthcare providers, and healthcare delivery organizations. It's important to understand the influence of the big picture has on healthcare and how the world affects smaller subsystems. So, just what we talked about before, all of the things in the healthcare system, the providers and the delivery organizations, so the offices and the hospital units and nursing homes, all affect the patient, all affect when the medications are given, where they come from, how they're paid for. All of it interacts back and forth in an open fluid motion within a system. So in conclusion, our conceptual framework operationalizes the philosophy and establishes a mode for nursing education through which the student acquires your knowledge and your skills and your attitudes to become a nurse. We believe our philosophy is a statement of beliefs that are the foundation for us helping to provide excellence in nursing education and helping to develop you into the best possible nurse that you can be. Thanks.